tell me when you're ready.
Oh, I'm ready.
Okay. All right, so this is going to be cervical flexion extension. We're going to use the axis variant from your book. Your book calls for using the lobule of the ear. We're going to use the external auditory meatus. It will always be there even on your burn patients. So that will be the axis. The stationary arm is going to be perpendicular to the floor. And you notice I have it aiming up toward the ceiling, because if we turned it perpendicular to the floor, it would run into acromion. And the movable is going to be the base of the nares. The reference angle of the goniometer is 90 degrees, so you'll be reading from the red scale. So if you would, tip up and look up toward the ceiling. I'm going to get those measurement points and have you relax while I read them. And we have 25 degrees of extension. And now if you would, look down for me, and we're going to measure flexion. And flexion is, okay, you can relax, with 40 degrees. Okay, and we're done. You ready?
Yep.
Okay, this motion is for the upper trapezius. This is scapular elevation. So you ask your patient if they can shrug their shoulders up toward their ears and back down. That would be a 3. So you would have them shrug up again. Hold there, don't only push you down. 1001, 1002, 1003, and relax. That was a 5. If she gave, that would have been a 4. Now to do a 210, you have to have your patient lie prone. So if you would, hop up here on your stomach. And you would do one side at a time. And what you're going to do, now they're gravity reduced. Can you bring your shoulder up towards your ear? That would be a 2. The upper trapezius is here. So you would palpate here for a 1. If nothing happened, that would be a 0. Okay. All right, the next motion we're going to test is going to be the middle traps. And with the middle traps, you're going to have the arm abducted to 90 degrees, thumb up toward the ceiling. And it is not a glenohumeral motion, so it is squeezing the shoulder blades together. So squeeze the shoulder blades together. So we're going here. If she were to do this, this would be using the posterior delts. It's glenohumeral, so you want to make sure that it's just coming from the scapula. So pinch the shoulder blades together, all right, and back down. So that was against gravity. That was a 3. And then remember, these muscles do not cross the glenohumeral joint, so this is where your book is a little bit wrong. She's going to come up again. I'm going to apply my resistance on the lateral acromion. Hold there, 1001, 1002, 1003, and relax. So she held, so that was a 5. If she would have given, that would have been a 4. Stop for a second.
You are.
Okay, so for the middle traps, for the 2 position, to reduce gravity, they want the arm supported on the table. Remember, we had it at 90 degrees, so with a high-low table, you can adjust it to 90 degrees, and then you want to ask if the patient can squeeze the shoulder blades back together. That would be the middle trap. That would be the 2. This is where you would palpate for a 1. If nothing was able to happen, that would be a 0.
Go ahead.
Ready? Okay, the next muscle we're going to test is the rhomboids. Now the middle trap we had out here with the elbow extended. We're going to use the alternative test for the rhomboids found on page 11 in Clarkson, where you're going to bend the elbow to 90 degrees. And now if you could, just try to raise your arm up toward the ceiling there. And that is for the rhomboids. So that would be a 3. The resistance is going to be on the lateral scapula. Hold there, don't only push you down. 1, 2, 3. And I'm just kind of stabilizing the opposite side of her shoulder so she doesn't roll. When we do this, relax. Now the nice thing about this is the 2, what you do is just give a little bit of support for the arm. And now can you squeeze the shoulder blade together, lift your arm up? So that would be a 2 with your support. You have your fingers right here to feel for a 1. If nothing's going on, it's a 0. this motion will be shoulder flexion, the anterior deltoid. What you have to make sure is to go through a range of motion that you start with their arm at 0 degrees and they can go up to 90. Common mistakes are made, if you would scoot over about a foot to your left, is students doing this, where the elbow is bent and restricted and coming up. So you want to make sure, scoot back over, that the elbow is extended so that you can go all the way up to 90 degrees. So that would be full range of motion against gravity. Then you're going to stabilize with one hand on the scapula. Your resistance is going to be proximal to the elbow. You're going to push down, hold there, 1001, 1002, 1003, and she did hold, a little shaky, but she held. Relax, relax. So that would be a grade of 5. If she gave, it would have been a 4. Now, for the 2, what we're going to have you do is you're going to lie on your side facing the board. All right, and this is just for photographic liberty. I know I'm using the other side, but just so we don't have to change the camera person. Relax. I'm going to have her relax and support her arm. So this is very similar to what we did at the hip. Is can you bring your hand forward? So this would be for the 2. The anterior deltoid is here to palpate for a 1. If nothing happens, it's a 0. Okay, the next muscle we're going to test is the latissimus dorsi and teres minor. And so you're going to have your patient prone with the palm facing up toward the ceiling, and you have them extend their arm as far as they can. That would be a 3. If they can go up, and we're going to apply some resistance, stabilizing the opposite shoulder blade, resistance hand proximal to the elbow, hold there, 1001, 1002, 1003. She gave a little bit, so that would be a 4. And so if it would have held strong, it would have been 5. Now for photographic liberty, I'm just going to have her turn and face the board here, so my camera person doesn't have to change. Now this is the opposite arm, but if you were testing, you would do the same arm. So this is gravity reduced, where she's going to have her palm facing me. I'm going to support the arm, and can you come back? So that would be a 2. The lats come up here underneath the axilla. Here's your teres minor. So this is where you would palpate, come toward me. So that would be a 1. If nothing was going on, it would be a 0. One we're going to test is abduction. Similar to flexion, is that you must have the patient on the side of the table so that the arm can be fully extended. And what you're going to do is come up in the motion of abduction to 90 degrees. So can you do that for me on your own? That would be a 3. And come, relax a little bit. You're going to come up here, and resistance proximal to the elbow, stabilization posterior scapula. Hold there, don't let me push it down, 1001, 1002, 1003. She's a little bit shaky, but she did hold, so I would give her a 5. If she gave, that would be a 4. And for the grade 2 position, if you would, lie down on your back and scoot over that way a little bit. So with the arms supported on a large mat table would be the best. What she's going to do is see if she can take it out to the side. The table offers the support, so if she can do that, it would be a 2. If you palpate here, it's the middle deltoid, so that would be where you would palpate for 1. If nothing happens, it would be a 0.